Hi there, this is Steve Grady with Steve Grady Insurance Services, and today we're actually going to talk to one of the carriers. That's going to be Sharp Health Plan, and my dear friend Cheryl is here with me, and we're going to kind of just ask them a few questions. What's going on, in the healthcare environment right now with COVID-19, and it's sometimes it's good to just hear from the carrier themselves. So, how are you, my friend?
I'm doing really well during this trying time for everybody. We're,
Absolutely. Why don't you
we're
tell
social
them?
distancing.
Yeah, yeah, it's tough. It's tough on everybody.
It
So why don't
is
you tell, let people know who you are, and I know you've been with Sharp Health Plan for 9 years.
9 years, Steve.
Crazy.
I've been working with you for 9 years.
Wow, wow. I got a couple gray hairs here. Anyways,
Yeah,
why don't you just give us a little background of who you are, what you do, and then I got a
sure.
couple questions for you.
Okay, perfect. Well, I'm Cheryl Cote. I am a sales executive over at Sharp Health Plan, 9 years. Been working with Steve as a broker for 9 years, one of our top producers. So thank you for your partnership, Steve. I must add
Absolutely,
that. Thank
absolutely.
you. So Sharp Health Plan is a wholly owned subsidiary of Sharp Healthcare, and Sharp Healthcare is the delivery system that everybody knows. We're the largest private employer here in San Diego, so the Sharp name is out there.
Awesome.
And what's different is that we are a local nonprofit healthcare plan here in San Diego.
Very
So
cool.
that makes us
I'm very
unique.
biased to Sharp. I was born at Sharp. My daughter was born at Sharp, so
Good.
I know the system, and so I'm very close to the system. So what is Sharp doing right now with, COVID-19? Are you testing? Where can people get tests? If you are, kind of maybe give me just a little, tidbit of what you guys are up to.
Sure. So, yes, we are testing for COVID-19. So, currently at the delivery system at Sharp Healthcare, we're testing about 150 on average
Oh,
in a
wow.
week, people. So, yeah, with the capacity is at 950, so we can test many, many more if needed. So, we are testing over at the delivery system. And Sharp Health Plan, as the carrier, we are providing all the tests and the screening at zero copay for our members, so they
That's
don't pay
awesome.
anything.
Yeah,
It
very cool.
is. That's huge right now. And then if you're test positive and you have to go into the hospital, have whether it's urgent, emergency, or you're spending the night in the hospital or staying in the hospital, all
Okay.
that's being covered. So we're waiving all co-insurance, co-pays, deductibles. That's covered at
Even if you
100%,
stay in the hospital?
even if you stay in the hospital.
Oh,
So
that's
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 being,
insane. That's
it
incredible.
is.
I'm glad I have
Yes.
Sharp Health Plan as my carrier.
Yes.
Um, that's awesome. So what are you guys doing anything for the community at all, or outreach,
Yep.
telehealth, anything like that? You can kind of
Sure.
touch
So
on?
telehealth, you and I have talked about this, and I really think this is a great way. We're trying to keep our members safe, right? We want to keep our members safe, their families safe, and obviously our providers safe. So we are doing telehealth. So
Okay, cool.
telehealth services for COVID-19, it's a zero copay. But
Wow.
if you need to see a provider outside of COVID-19, so any follow-up or anything that you need to see, it's following copay. So if you see a
Okay.
specialist, it's a specialist copay. If you're communicating with your doctor, it's a PCP, primary care doctor copay.
Okay. And I know you work with the Minute Clinics. Is that right, with CVS?
We
Are
do.
those still available for people to go to?
Not going into
Not
CVS,
going in.
no.
Okay.
So that because of COVID-19, they're not allowing and doing walk-ins anymore, but they are doing, again, the telehealth services through the Minute Clinic, and it's
Okay.
following your PCP copay. So that's still available, but we don't get to walk in like we
Yeah,
used
no,
to and just show up.
that's fine. That's
Yeah,
fine.
yeah.
What other things are going on in Sharp Health Plan?
Yeah, one of the unique things, because we are local, we are working directly with our members. We're doing outreach to our members. So the vulnerable people that we have, so the elderly people, people that have chronic conditions, we're doing outreach phone calls to them to
Okay.
make sure that they're educated around COVID-19, to make sure they understand if they feel safe, questions, what happens if I have the symptoms, what do I do? So one question that you did kind of ask before is, what do I do if I think I have symptoms of COVID-19?
Right.
Most people like, what's my hospital do I go to? You need to call your primary care doctor first,
Okay.
communicate with them, and then they will set you up on the next steps on what to do. So
Okay.
that's important to keep that in mind.
So ongoing testing, are you seeing a flattening of the curve? I mean, I know we sell the products, but do you know anything about that at all?
I don't kind
Okay.
of know.
I
I
just
just
thought I
know
asked.
that our beds are ready if we need them.
Okay.
So our capacity is there. We're working on strategies daily for if that surge does happen. So that's PPE, that's people being able to get our workforce being able to get their supplies. What if we do need to have more tests? What happens if we do have more admissions? So we have beds available. We have over
Okay.
1,000 beds
Oh, wow.
available.
My phone's acting up on me. Sorry. Siri's talking to me while you're talking to me. Well, this is awesome information. Do you know what's going on or, in the future with Sharp Health Plan? Do you guys have any, can you give us any insight of what's happening here in San Diego County?
Yeah, I mean, our membership has grown in the last 9 years that we've been kind of talking. We are the #1 member rated health plan out there. So we're
Wow.
#1 in California, which is huge. And then we're top 10 in the country. So that's also just kind of, we're making kind of our name out there as being a San Diego based company, kind of like you're involved with your clients locally, hands-on. We're doing the same thing. So you're going to be definitely seeing more of Sharp.
Okay, sounds good.
Still
Siri
going.
still wants to talk to me. Sorry, guys.
Your daughter.
Yeah, right. Well, this has been awesome. I think we need to do more of these, and we can talk maybe quarterly where we can see what's going on, rates and this and that. I know, the bottom line is
It's cost.
It's cost.
Right now, right,
It's cost.
Steve?
And I know
It
you're
is cost.
still extremely competitive in the marketplace. So
We are. Just a couple more things. Just I want to make sure that
Absolutely.
people just
Go for it.
kind of think in mind on stuff. So if you do need to just have questions, you can go to our website, www.sharphealthplan.com/COVID-19. It helps answer some questions for you. You can Google some things.
Okay.
Our member services are here locally in San Diego. So you're talking to local people. That's happening here in our community. That number is 800-359-2002.
Excellent.
The other thing that we're doing is relaxed participation for your refills for your prescriptions. So
Oh, really? Great.
So if you are doing maintenance medication, a lot of the local pharmacies are actually delivering free of cost. So kind of keep that in mind. So you can kind of do that, as well as if you're a Sharp Health Plan member, we use CVS mail order. So you can get it delivered to your home. So it's just an easy way for members not having to go out when they don't need to.
No, this is amazing. This is great.
Yeah.
It's amazing how the carriers, or especially you guys, are stepping up, like really reaching out to the community, which is so important. And it's just refreshing to see.
Yes, it is.
Well, thanks for joining me today. And we'll do more of these. And that way we can keep up to date with Sharp Health Plan.
Okay.
So if anybody has any questions about Sharp Health Plan, or maybe interested in signing up your business, give me a call. I'm here, and I will bring Cheryl with me to the meeting. All righty. Thanks so much for joining me.
Thank you very much, Steve. Thank you, everybody.
Thank you. Okay. Bye.
Bye.